You want to be completely well from endometriosis? You need to get a complete surgery. Hi everyone, welcome again. So today, again and again, it's always endometriosis. Complete surgery number 1. Open surgery is definitely never complete. So they tell you in this case you have to do open. It's true, but when you do open surgery, it's never complete surgery. Why? Because when you open such a small line in the tummy, at the lower part of the tummy, you can only see what's at the lower part of the tummy. What about upper part of the tummy, middle part of the tummy, higher up? Cannot see. Got endo also don't know. So you will definitely leave disease behind. The closest you can go is laparoscopy. Laparoscopy, because you put a camera in, you can see the whole tummy. So now you can see the whole tummy. Okay, then you can remove whatever you can see. But the question is, can you remove whatever you can see? And thirdly, of course, you ask me, the best would be robotic surgery. Because robotic can see everything as well, just like laparoscopy. But now the person doing the surgery is not me, but the robot. So I always like to describe, because robot is robotic assisted laparoscopy. So ultimately it's still laparoscopy. But you use a robot to help you. Why? Few reasons. Because in laparoscopy, we don't get to see inside. We are looking at the TV. And the TV is placed like 4 feet to 5 feet in front of us. So first is a 2D image. And the TV is not really that big. And it's placed so far away. So vision is not as clear. In robotic surgery, it is a 3D image, and you look, the image they give you is like a microscopic image. Basically, it's like a microscope. I look in, I look direct inside. Image is super. As a result, because when you are dealing with very complicated surgery, you want to see things very clearly. Because I told you, you have to operate, you want to remove all the roots. Are you able to see all the roots so clearly? Number 1. Number 2 is, if the roots are so near the bowel and the ureter, you want to see it so clearly so that you know when you cut it's safe. When you don't see so clearly, you'll be a bit more cautious. So you may leave one layer behind. Because like for example on ureter, I've done so much on ureter. And if it's on robotic, I can really get it onto 100% peel off and I don't see any more endometriosis on my ureter. But if it's laparoscopy, I am a bit more cautious, so there's usually one more layer. That is why robotic gives you one advantage. There is a second advantage with robotic. It's the instrument itself. I describe it as a scissors. Like in laparoscopy, we have scissors. In laparoscopy scissors, this thing cannot move, so we can only cut this way. We can cut this way. We can't cut this way because this thing cannot bend. Laparoscopy, we cannot bend this way. We can only cut this way. So sometimes again, in very crucial areas, you are limited because your scissors cannot bend. In robotic, the scissors can turn any way you want. And because of that, it gives us better flexibility in our instruments. So when we cut, we can make sure that we cut out 100%. We can see so well and we can cut so well. So that is very important. So that is why for endometriosis surgery, if you give me a choice, I will always ask patient to do robotic. I always tell patient, if you can afford it, please pay for the robotic. Those people who have previously operated and come back again and want another surgery, I always tell them, please pay for your robotic. As long as you can afford it, please pay for it. Because it makes a lot of difference. Because nobody wants to go for surgery again and again. You don't want, I also don't want. So anything you want to ask, please feel free to put it in this comment section. Thank you for joining me, and if you want to look at all my old videos, don't forget, go to my YouTube channel. So that's all for now. Thank you. Bye bye.